So my name is Ugochukwu Paul Nnamdi, sir, and I'm presenting on household cooking, fuel, and respiratory health condition of under 5 children in Abuja. So I'll quickly go to my aim and specific objectives. My aim is to assess how cooking fuel, types, respiratory health status of children of under 5 in AMAC, Abuja Municipal Area Council. And my specific objectives are to identify the commonly used household cooking fuels, the types in AMAC, to determine the proportion of household cooking using each of these cooking fuel types, to assess the respiratory health status of children of under 5, and to identify the determinants or factors associated with this choice of household cooking fuel types. Then I used my study area is Abuja Municipal Area Council, and my study design is descriptive cross-sectional study design. And this I study population, of course, AMAC and children of under 5, inclusion and exclusion criteria. So my sample size, I used a Croken formula for cross-sectional studies, sir. And this is my slim method. We have 12 walls in AMAC, and I selected 5 of them, and this is how I staged them on stage 1 to 5. Then these are the walls I used. Nyanya, Gariki, Lube, Karo. And I use a structured questionnaire, face-to-face interview, to be able to get this data from them. And also I sought for consent from head of households for me to be able to assess their women. So my response rates are, I got 94.1%, owing to the fact that some questionnaires were not properly filled. Out of 425, I got 400 questionnaires back. And these are my results according to my the table 4.1. I saw under democratic caregivers, we saw that.
Move on. Move on.
Okay, I'm moving on.
No. We didn't say you should conclude, though. We said you should move on now. So one after the other.
Okay, sir. Sorry, sir. So, the primary and secondary fuel types, we saw that most people who responded using LPG gas.
Move on.
Okay. So here we see that gas burner is what people majorly use in the settlements where I asked.
Agasa. You know, I know you want to do this. Why is it I study design?
Okay, let me go back.
No. Just no. You don't need to go back. Just state your study design, so that we are going to interpret that before and after.
Descriptive cross-sectional study design, sir.
You know what cross-sectional study design is?
Yes, sir.
What is it? That moment in time, a snapshot of the situation at the time of the study. Right, so just go move to your what is it called now? Yeah, before and after fuel subsidy or something like that.
Here?
No, move on. Fuel type, stove type, before, fuel subsidy pattern, switch to. So how did you determine that? Oh, but okay, so move to the listing now.
Sorry, size. I think it's network that is delaying it.
The fuel study stuff you mentioned.
Sir?
The fuel subsidy. Okay, sir.
Prof, can you hear me?
Fuel subsidy. Look at now, if it's you said fuel subsidy, how did you determine that information if it is a cross-sectional study?
So, sir, because I questioned, I asked them what they were using before the
Go back.
subsidy release.
Let's see. Let's just see, please. Let's go back to that result. Let's be sure. Let's be sure if it is presented well. Go back now to the. Oh, I have noticed that you are Professor, this is frequency. This is what is it called now? Some of at times these things are stated in logical. This is a proportion. Respiratory health over the past this thing. Just give us the frequency of these ones, and you are giving. It is a questionnaire, so you can't be talking about the clinical diagnosis. You can't be talking about clinical diagnosis. You can't be talking about. You can't rely on what the patient told you. So I don't know about this. And this was during Harmattan season. This study is about fuel, domestic fuel and respiratory health. So Harmattan shouldn't come in. Harmattan shouldn't come in because.
Okay, Prof.
Move on to the next. Okay, it's all right. Go on. Anyway, you see, when when you in statistics, when you begin to have zero, it disrupts a lot of the calculations. That's why it is better to just classify them, certify them into clean and then unclean fuel. Clean,
Okay.
Clean. You can add the gas and electricity together, and then kerosene, firewood, and kerosene, charcoal, and firewood together, so that you will be analyzing two, so that to avoid you won't do zero. Once you have zero, it's a problem. Once you have zero is a very dangerous figure to have in statistical calculations. In fact, if any cell, usually they say if any cell has less than 5, it has to be corrected. You have to apply correction. So not to talk of zero. So please.
Okay.
So if you are table 4.6, you have to recalculate and stratify into clean fuel, sources of fuel. Move on to the next. Okay. In Abuja now they say cross ventilation. Is there any other way? Is there any other method of ventilating a kitchen?
Depending on the locality, the words, how
is it AMAC now? AMAC is this thing. Is there any way, because you are interested in ventilation? How are you going to? How did you rate them as good, fair, and poor? Well, you have to present something that you'll be very, very proud of.
Okay, sir.
Those houses you have, how many windows do they have in the kitchen? if you go to Aso Rock, do you think they will have cross ventilation in Aso Rock? Huh? But does it mean that their kitchen is not properly ventilated? When they were using cross ventilation, it's during the colonial days. Now they know they use any cross ventilation. Do you know what they use?
They use vents, sir. They use.
They use vents.
Some of the. Depending on the area.
They use an air extractor, or what is it called now? Air expeller. That is what they install in kitchens.
In the kitchens.
That is what they install.
Depending on the area.
No, that's oh. You are assessing quality of ventilation. It is not. Quality of ventilation is standard now. It doesn't, and they are doing it at Amac. To find out whether the kitchen is poorly ventilated or not, well ventilated or not. That is the in your case now. You said good, fair, and poor. So if you state that, it means that in your data analysis, you are going to state what you considered as good ventilation, and definitely not just cross ventilation or open air. Once you have mechanical means of ventilation, is accepted. In fact, that is the standard now. It's just like a room. You go to a room and you say they don't have windows. If you have an air conditioner, do you need a window to ventilate for ventilation?
No, sir.
No, sir. You know, when you carry out a study, you become an expert in that area. You become an expert in that area. So when you say these things, anybody that knows this thing will just know that you don't know much on that. So move on to the next. Move on to the next. Okay, so just move on. No symptoms and then symptoms. Duration. Switching status. But I guess okay. Okay. Okay, let's move on. Move on. At least this one now, we have met the minimum acceptable standard. Go to a conclusion. Oh.
The study concludes that.
Morgan, wait. You know, this hypothesis testing. You know, in public health, we don't test our hypothesis separately. They do that in social sciences. Just go to hypothesis testing. Go to hypothesis testing. Okay. No, this one now, you know, I commonly see this. We commonly see this. We commonly see this. It shouldn't appear. In fact, if you have it in your dissertation,
Okay,
I'm sure you have it in your dissertation, go and delete it. Except if you, for official plagiarism, you are interested in that 25,000 words, you can send that one though. So in order, you can include it in 25,000 words. But the one you are sending to the external examiner, remove them. Because what you are doing, especially that cross tabulation, those cross tabulations he did, the hypothesis testing. Because the hypothesis testing is just to look at whether it will yield the p-values. So if you just go back to those results. Go back to those results. No,
okay.
Go back. Oh, yes. You see those p-values?
Yes,
So
sir.
you have tested
Yes,
the
sir.
hypothesis that there are statistically significant differences in the use of primary fuel, that social demographics affect social demographics affect the use, the type of primary fuel used in households. That is a hypothesis. And it has yielded, look at these p values. So you can say that household income actually influence the choice. Same way, same
Choice of
thing as social caregiver education. Same thing as employment status. Okay, so there is no need for you to
yes, sir.
go and establish, have a separate section on hypothesis testing. I'm saying that so that others will also know or
I will
learn
remove
from
it, sir.
us. Okay, especially the one you are sending to the external examiner.
Okay, sir.
Okay,
I'll remove this one, sir.
yes, okay, it's all right. Dr. Mo, do you have any further comments?
No comments.
Okay, thank you very much.